Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. As we discussed earlier in the show, millions of women across the country, as well as many men, will receive breast cancer. But there is hope in this battle against this life-changing disease, and many local resources and groups are available to help. Well, joining me today now is Susan Earnest, a breast cancer navigator with Washington Regional Medical Center in Fayetteville, and Farah Buck, a local breast cancer survivor. Welcome to the show. Thank you so much to both of you for being here with us today. We appreciate it. Okay, Susan, let's start with you. What is a breast cancer care navigator?
The Navigator program actually started in the early 1990s in New York City when they found that women were not keeping their appointments, and they realized they needed somebody that would kind of coordinate and make sure women got from point A to point B. So that's how long this program's been in existence. And so what I do is I try to meet with women early on in their diagnosis and kind of sit down with them and kind of tell them what they can possibly expect over the next months or years. And frequently, one of my jobs is working with coordinating the breast conference that's held every Thursday morning. So I also take notes there, so I have an insight also to what they might be facing that way.
Very good. And what type of services are offered to these women and men who have been recently diagnosed with breast cancer, other than the teachings and the classes that you just mentioned?
Okay. What I do is I give them a nice packet of information that's very helpful. I give them the information about support groups. At the Cancer Support Home, we have several support groups. We have one for young survivors. We have one for primarily breast cancer survivors, but also other women can come in who have cancer because there are so few support groups for other cancers that we do those on Monday nights. And I also have a support group in Bentonville.
Excellent.
And then I will frequently refer people to other services in the community.
Is this a national program then?
Actually, it is. It is.
Okay, and what type of person is actually a candidate for these services? You have to actually be diagnosed with breast cancer?
Actually, I have met some women before they've been diagnosed. I'll go with them occasionally when they get their biopsies, or if they're fearful of getting a diagnosis, I'll call and talk to them, and I'll offer to go with them and just hold their hand if they need that.
So excellent support.
Yes.
Very good. And what, from your experience, what would you say is the ultimate benefit of having a breast care navigator?
I think one of the benefits is I get to be with them from the beginning all the way to the end. I'm the constant person that gets to stay with them. And I can be available to just call for any questions. And initially, I can usually spend quite a bit of time sitting down with women and just help them understand what the process is that they're going through.
And from your experience, how do these patients, how do they find out about your services in the program? Is it something that each breast cancer individual patient is referred to automatically from their physician or from the person that diagnoses them, like the radiologist?
Right. Primarily, I get most of my patients from the breast center, and they will ask women, tell them about my program, and then either I will call them or they will call me. But I'm going on my 7th year now, so I get a lot of referrals just from other cancer survivors who have a friend or a relative. Excuse me. And then the oncologist will call me and the surgeons will call me and ask me to meet with patients. So.
Very good. Now, is this service available to all men and women, or is there a cost? Is it free? It
is free.
Wow.
All the services of the Cancer Support Home are free because we're totally grant funded. So it's a wonderful program. And I get a lot of my funding from the Susan G. Komen Foundation. So anywhere there's a person that has breast cancer that needs some additional support, if they don't have access to a navigator, I'll be happy to help them in any way that I can.
All right. Now, you know Farah, is that right?
Yes, I do.
Through the Breast Care Navigator program. Farah, thank you so much for sharing your touching story with us. We appreciate it. How has being a part of this program helped you get through your experience?
Well, I went and had a mammogram at the breast center, and actually, when I came back for my biopsy, I believe that Susan had called me prior to the biopsy, and had met me there, and I got to meet her prior to that, and that was just, it was nice to have that support. And she was so knowledgeable, and she gave me a pillow and a bag with all sorts of resources and a really great book about breast cancer and all the stages and what to expect. And then throughout my diagnosis and treatment. She was there. She would come to the Highlands oncology group to chemo and be meeting with different women that would go and have chemotherapy. She would be there much of the time. And
so you were undergoing the same type of treatment that other women were going, and having that support.
Right.
Did it definitely, I guess you could say it definitely helped you to get through it and have other women who are experiencing the same issues that you
Right.
were.
Well, that was at the women that I met at the cancer support home. Susan told me about the Young Survivors meeting, and I started going to those pretty soon after I was diagnosed, and met, and actually the group kind of grows as the months progress. We have new women that come in and some women that leave, so it's just been just a great group of women to get to know that can share the same experiences.
Would you recommend the Breast Navigator support system for other women as well?
Oh,
just
yeah.
to help get through this
and the
program?
cancer support home classes or groups. Yeah.
So you've received a call from Susan, and just having someone to hold your hand, so to speak, and just be there for you. I just can't imagine how invaluable that must have been.
Oh, yes, it was.
Especially, the information that they provide not only helps you get through what you're going through, but teaches you and educates you so that you know what you're dealing with in advance.
Yes.
And that, in a sense, helps alleviate those fears and those concerns, not only for you, but for your entire family and loved ones as well. What advice would you have for women who are watching, or men who are watching our show, that might be one day in your situation, or maybe have just been diagnosed?
Well, I would say for me, just pay attention to your body. You need to really be giving yourself self-exams. If you feel something and you're not sure, go get it checked out, because really the best promotion or prevention is early detection. I mean, for me, I was nursing a baby and I got a little small lump, and I was told it was probably normal, but I still went in and saw Dr. Paulson in Fayetteville, who's a OBGYN, and she said, well, that's normal, but I'm going to send you for a mammogram anyway. And the mammogram showed that was a fibroid adenoma. It was normal, but they found cancer in another area of the breast.
Wow.
And so it was just a blessing. Actually, what the radiologist said was that was just a gift from God to have that red flag there, because without that, I wouldn't have known that the cancer was growing, and actually I had already spread to my lymph nodes without me knowing. So really being aware of your body, and if you have any doubts, not just ignore them, but go in and get an exam or test.
Very good, wonderful advice. Now, I've read your article, and it mentioned that breast cancer is an expensive disease.
Yes.
Tell us about your involvement with the Hope Cancer Resource.
Okay, sure, yes. Well, my husband is gone back to school getting a PhD, and we have quite a few children. And so it was, struggle financially to begin with, but then with having breast cancer, it became more of a struggle because of deductibles and all those kinds of things, and travel to different doctors and places. And Hope Cancer Resources has an application process where you can kind of give your family expenses and then apply for some aid. And we did that, and we did receive aid. It's not, for us, it wasn't a monthly thing. It was just a lump sum of money that we could use to help pay for a drug that my insurance was not paying for. So that really helped out a lot.
That is fantastic. So there are lots of resources.
Yeah, and I think go ahead.
There are Hope Cancer Resources, a great resource. They also, not only do they have financial assistance, they also have counselors. And I find that I've used them several times, referring women to just talk to the social workers there. And they also have interpreters, Hispanic interpreters, so I've used their services to coordinate with some of my Hispanic women.
Very good. And I understand the Northwest Arkansas Free Health Clinic offers free breast exams as well?
Well, actually, we have a program called No Excuses, and Audra Flaming runs that program. And we offer 6 clinical breast exams a year, and 2 of those include pap smears. And we did do a trial of clinical breast exams after the race yesterday.
Very
as
good.
as
All
a
right.
first-time event.
Very good. Susan, where can one go to get more information? Is there a phone number or a website available?
Yes, well, there's a website on Washington Regional's website, but under the Cancer Support Home. But also our phone number is 521-8024, and we are going to have a breast exam next Saturday.
Very good.
Celebrate the Fayetteville.
All right. Well, thank you so
location.
much to both of you for being here today. We appreciate it.
Thank you.
All right. Stay tuned. Family Health Today will return in just a moment.